Warm, conversational. The hospital IV bag is one of the most common sights in a patient's room. It is often viewed as simple hydration, standard water for a body that cannot drink on its own. In the intensive care unit, doctors treat this liquid as a prescription medication. Every bag requires a measured dose because even simple water can cause serious side effects in a critically ill patient. Think about pouring oil into a car engine. The engine needs it to run, but if you pour in too much, the entire system chokes. The human body works the same way. When a sick patient receives an excess of IV fluid, their internal system can literally flood. Doctors call this dangerous condition fluid overload. This chart shows how quickly that flooding becomes dangerous. If a patient's body weight increases by just 10% due to fluid accumulation, their risk of severe complications goes up significantly. Because of that risk, medical teams manage IV fluid using a strict daily prescription. They rely on a framework of checks and balances to ensure the patient gets exactly what they need to stay safe. That framework is called Fluid Stewardship. It is a checklist of 7 specific steps, the 7 Ds, that guides doctors through a patient's critical first week in the hospital. The first step is definitions. Before starting treatment, the team establishes exactly what fluid overload looks like for that person. Next is diagnosis. Is the patient's blood volume actually low, or is an illness making it appear that way? To answer that, the team looks at laboratory tests, clinical signs, and radiological scans. They use these tools to measure what the body is doing, rather than relying on a best guess. Defining the problem and diagnosing the patient's actual needs first prevents the team from accidentally flooding a body with fluids it doesn't require. Once the team has identified the exact problem, they move from diagnosis to action. They write the liquid prescription. The third D is drug. The team selects the right liquid for the situation. They might choose an aggressive fluid to stabilize a patient in crisis, or a basic maintenance fluid to provide daily stability. The fourth D is dose. For daily maintenance, the team uses a precise calculation: 1 milliliter of water for every kilogram the patient weighs, every hour. This is balanced with specific amounts of salt, sugar, and potassium. The fifth D is duration. The IV drip does not run indefinitely. It is prescribed for a set window of time and stopped as soon as the patient's body reaches its target. Treating the type, amount, and time limit of IV fluids like a pharmacy order ensures the cure remains a benefit rather than a burden. A few days later, if the patient has stabilized, the medical priority undergoes a complete reversal. Look at the center of this flowchart for the sixth D, de-escalation. The team stops putting new fluid in and focuses entirely on getting the excess out. Doctors call this process late goal-directed fluid removal. It works like opening the spillway on a dam, using medications or dialysis machines to steadily drain the excess floodwaters from the body's tissues. Finally, the seventh D is document. The team audits the daily balance to check their KPIs, or key performance indicators. These are like a scoreboard for the medical team, ensuring they stayed on track and accounted for every drop administered. It is the central paradox of the ICU. The aggressive fluids that save a life on day 1 require an equally aggressive strategy to remove them by day 4. Modern medicine has shifted towards seeing fluid management as an active daily commitment. Executing this 7D framework requires a dedicated fluid team. Doctors and nurses work together as stewards, watching the numbers to maintain the body's internal environment. The next time you see an IV bag hanging by a bed, you will see more than just water. It is a highly calibrated medical tool that requires constant attention. Respecting IV fluid as a potent drug is the key to maintaining balance, giving the most vulnerable patients their best chance to recover and return home.